If you are joining the UK NMC as an adult nurse, then these are the stations you need to prepare for your OSCE exam. Starting with the API stations, the assessor is going to select one out of these 10 scenarios or conditions for you to complete the assessment, planning, implementation, and evaluation: Alzheimer's disease, chronic heart failure, community assessment, ectopic pregnancy, end of life, suspected deep vein thrombosis. This is one of the new stations that was introduced in January 2026. Hernia, homelessness, pneumonia, and subdural hematoma. These are the 10 scenarios for which you are going to get one out of these 10 to complete the assessment, planning, implementation, and evaluation. Now, there is something I want to point out. Because of the introduction of suspected deep vein thrombosis, falls and fracture has now been taken out of the 10 stations, and these are the time allocation for each of the 4 stations under the API stations. Assessment, you allocated 20 minutes, planning 14 minutes, implementation 15 minutes, and evaluation 8 minutes. For the scale stations, you already know that we have the performing stations and we have the non-performing stations. And you're going to be assessed on 4 stations out of these 21 scales stations. Let's go through the stations: administration of inhaled medication, administration of suppository, anti-embolism stockings. This is one of the new stations that has been introduced: blood glucose monitoring, bowel assessment, catheter specimen of urine, fine bore NG tube, fluid balance, intramuscular injection, IV flush and VIP score, nutritional assessment, oral care plan, oxygen therapy, pain assessment, peak expiratory flow rate, preoperative check. This is also one of the new stations that has been introduced to the Adult Nursing OSCE stations: pressure area assessment, removal of urinary catheter, subcutaneous injection, MSU and urinalysis, wound assessment, and aseptic non-touch technique, known as the ANTT. Out of these 21 stations, you have 5 non-performing or silent stations and 16 performing stations. Let's look at the evidence-based practice stations. You're going to be assessed on one out of these 15 stations under the evidence-based practice. Let's go through it together. We have ankle sprain, bedside handover, cervical screening, cholesterol and coffee. This is one of the new stations that was introduced in January 2026. Dementia and music, diabetes, female MI symptoms, fever in children, honey and propolis as HSV treatment. This is also one of the new stations. Honey dressing for venous leg ulcers, osteoporosis and exercise, pressure ulcer prevention, restraints, saline versus tap water, and smoking cessation. For professional values, you are also going to be examined on one out of 13 of these stations under the professional values, and they include bullying, deteriorating patients, drug error, falsifying observations, falsifying timesheets, hospital food, impaired performance, laboratory results, patient private details. This is one of the new stations: possible abuse, racism, social media, and witnessed abuse. These are the 13 stations you are going to be assessed on one out of these 13 stations, and this is what will make up the 10 stations you are going to be examined on the day of your OSCE exam as an adult nurse. I hope this helps. Don't forget to leave some few likes and share to a nurse who is currently preparing for the Adult Nursing OSCE exam. See you in the next one.